Hello and welcome to my presentation on fluid balance to healthy aging. We're going to talk about the role of the lymphatic system in longevity. My name is Kathleen Helen Lisson. I am board certified in therapeutic massage and bodywork and a lymphedema therapist, as well as a yoga and meditation teacher. I live in San Diego, California, in the United States. I'm the author of Stress Reduction for Lymphedema. So these are my disclosures, and I invite you to both of these upcoming conferences. Let's talk about the role of the lymphatic system. So we're going to talk about two main things. First, the functions and the failure of the lymphatic system. It's very important to understand why our lymphatic system is there and what happens when our lymphatic system really fails and when it's starting to fail. And then we're going to see the effects of inflammation, of aging, of a higher BMI, and of exercise on our body's lymphatic system. So the key functions of the lymphatic system, it's kind of like a caravan. It's taking goods from one place to another in our body. It drains the interstitial fluid in between our cells. It transports immune cells and antigens, so it's part of our immune system. It moves proteins, it moves cellular debris, so things that are waste products from the cells get moved into other areas of the body by the lymphatic system, and it absorbs and transports dietary lipids. And this should be interesting to you if you're focused on nutrition. So let's look a little bit deeper at that. So this is how the lymphatic system helps with lipid transport from our gut to our circulation. So lacteals in the intestine uptake chylomicrons and transform the free fatty acids during digestion. So lacteals are part of the lymphatic system. And then peripheral lymphatics move the larger fat molecules, including cholesterol, which is how our digestion is connected to our circulation. So let's talk about the benefits of the lymphatic system. So hopefully we're talking a lot about inflammation in this conference. It's a big driver of issues with the human body. And during inflammation, the lymphatic system actually removes excess fluid and immune cells, which is helping to maintain the tissue balance and reducing swelling. So the lymphatic system is your friend. A properly working lymphatic system can help during the inflammatory process. The lymphatic vasculature, so the lymph vessels, they play a crucial role in regulating inflammatory response because a good, well-working lymphatic system is going to help drain that fluid. It's going to help reduce that inflammatory mediators, and the white blood cells, again, are going through the lymphatic system. The lymph nodes are the home of the immune system. And in the setting of inflammation, lymphatic system, a properly working lymphatic system is critically important because you need this caravan in order to ensure tissue fluid homeostasis. So there's a lot of fluid, especially if the blood vessels themselves are leaking in chronic inflammation. So the lymphatic system is taking that fluid up. So if your circulatory system, if those blood vessels are kind of like the leaky pipe, you need the lymphatic system to take the fluid, which is in the wrong area of the body and potentially negatively impacting homeostasis. The lymphatic system, properly working lymphatic system, is going to be able to take that fluid away. So what happens when the lymphatic system fails? So we see this in cancer treatment. So when we're taking part of the lymphatic system out to examine it to see if the cancer has metastasized, the surgeons will take a lymph node or several lymph nodes out. And you may see, as a result, if part of the lymphatic system is surgically removed, you may see an accumulation of fluid, and we call that lymphedema. You may see, as the accumulation of fluid sets in and stays over the period of months and years because lymphedema is a chronic disease. There is no cure for lymphedema. You may see excess fat start to form in the tissue. This is not because the person is eating more. And at some point, if the person has lymphedema, it's not just swelling anymore. You will also see fat start to lay down in the tissue of this limb or this area that's swollen because of injury to the lymphatic system. You can also see chronic swelling and inflammation because, again, the lymphatic system isn't working as well as it should. And over the long term, you can see tissue changes, especially in the skin, especially in the skin of the leg. And you can also see fibrosis, and that's the scar tissue laying down inside of the area that is swollen. So these are some things that happen when our lymphatic system actually fails. It's struggling to keep up its job of being that caravan of getting things from one area to the other. But if you remove a lymph node, if you remove part of the lymphatic system, it's tough for the system to try to find another way through. And diminished lymphatic function is observed in many disease states, such as in infection and obesity, and as a complication of cancer therapy with ensuing secondary lymphedema and chronic fibrosis. So diminished lymphatic function is not just only people who have cancer treatment and then they get lymphedema. We have seen the negative effects of the diminished lymphatic system in many chronic diseases and also in people who have a higher BMI. So let's look at aging's impact on lymphatics, because this is about longevity. This is about aging. As we age, our organs can sometimes become less effective. Our systems can sometimes become less effective, and the lymphatic system is subject to this as well. So what happens to the lymphatic system when we age? Lymphatic architecture across the different organ systems does change during aging, and you will see an enlarged lymphatic diameter. So the actual vessels will become wider. You can see decreased pumping activity. So the lymphatic system moves in the larger vessel. On the vessel wall, there is muscle. And so you will see less muscle pumping activity as the person gets older, as aging happens. And also, unfortunately, a diminished response to pathogens. So that's the immune system part of the lymphatic system is changing. Chronic low-grade inflammation in peripheral tissues develops when the lymphatic structure or function is impaired as observed during aging. So you may see in the peripheral areas of the limbs, different peripheral tissue, this low-grade level of inflammation is because the lymphatic structure is not working at 100% because of aging. Let's also talk about BMI. So obesity-induced lymphedema, which we call in English OIL, O-I-L, obesity-induced lymphedema symptoms begin when the person's BMI is over 40, and they are almost certain to be occurring in people with BMI over 60. So if someone has a BMI over 60, they have lymphedema more likely than not. The vast majority of the cases, once you're at that high of a BMI, the additional fat in the body is causing dysfunction of the lymphatic system. And we see the symptoms of the lymphatic system really struggling with the higher BMI start at a BMI of 40. Let's talk about GLP-1 receptor agonists. So there's some very interesting research, some very interesting things that we have seen with the interaction on GLP-1 receptor agonists and the body's lymphatic system. So glucagon-like peptide-1 receptor agonists, GLP-1s, the treatment is associated with an 86% reduction in lymphedema risk for women who have had that axillary lymph node dissection for breast cancer. So this is a procedure where they take some lymph nodes out to test to see if they have cancer. So when the lymph nodes are removed, the body is at increased risk for lymphedema. But if the person is taking a GLP-1 drug, they saw that these people on the GLP-1s have less risk of actually getting lymphedema. This was a very surprising result. And the protective effect appears to be independent of their having diabetes or not. And it may involve mechanisms beyond just weight reduction, including the modulation of inflammatory and immunological pathways, which are implicated in lymphatic dysfunction. So the GLP-1 receptor agonists may be using their anti-inflammatory effects to helping reduce the risk of that patient getting lymphedema after part of their lymph nodes have been removed. And so they've seen in mouse studies that GLP-1 receptor agonists are actually expressed in the lymphatic vasculature, and they're highly enriched in the endothelium of the lymphatic system. So there are receptor agonists in the lymphatic system. And low-dose GLP-1 receptor agonists may restore pumping capacity of dysfunctional lymphatics. And these researchers say, could they possibly be delivered right into where the person has edema, which could minimize the systematic side effects? So if they possibly got the injection of the GLP-1 receptor agonist into the area where they're swollen, could the local lymphatic vessels in that area be improved? So let's talk about exercise. Exercise definitely has an effect on the lymphatic system. We know this from the basics of how the lymphatic system works. So it works through intestinal peristalsis. It works through breathing. So as you take the deep diaphragmatic breath, there are pressure variations in the thoracic and abdominal cavity that help move the lymphatic fluid. There's also the skeletal muscle contraction. So that's the exercise that we know. The skeletal muscle is pushing fluid through the lymphatic system just by moving. And also the lymphatics are next to blood vessels. So the pulsing of the blood vessels can help the lymphatic system to move. We know that aerobic exercise can reverse the obesity-induced lymphatic dysfunction independent of whether the person has weight loss. It can decrease the lymphatic inflammation, again, independent of whether they weight loss. It can restore the fluid uptake and lymph transport if the lymphatic impairment is obesity induced, and it can also affect transport of immune cells. So this is very interesting how aerobic exercise, you don't have to lose weight in order to have it improve your lymphatic system. It can improve the peripheral lymphatics as well. Again, thinking of leaky vessels in the lymphatic system, it can help enhance the frequency and vigor of the lymphatic pumping, getting that fluid, getting our caravan moving faster. And exercise may reverse pathology of lymphatic endothelium. So what about lymphatic massage? Does it have an effect on digestion and hormone levels? So the use of MLD can actually support the flow of nutrients transported by the blood to the tissues, as well as improving metabolism of adipose tissue, the removal of waste products. It can have a positive effect on certain biochemical parameters, including like insulin and the 2-hour post glucose in both normal weight and overweight patients. So let's look at the 2-hour post load glucose. They tested people and they found that the MLD may have a positive effect on this. It can reduce the level of oxidative stress and inflammatory markers, which may contribute to reducing the risk of the consequences of obesity. So what about leptin? We need to understand that leptin is mainly transported through the lymphatic system, and that improved function of the lymphatic system may have an indirect effect on an increase in leptin transport. So what are the take-home messages? Keep moving. For our patients, keep moving. Regular exercise can strengthen lymphatic function. The diaphragmatic breathing can help the lymphatic system. And then for the clinicians, for everyone here, practice lymphatic awareness, understand and really dive deep and keep a lookout for the research. How can supporting the lymphatic system help support your client's health? So there are some lymphatic myths. If they've reached Egypt yet, there are no miracle drops. There are no topical supplements that can cure lymphedema. Mechanical massage tools can offer assistance, but again, cannot solve lymphedema. Beware any miracle claims or non-medical devices. And compression garments can help manage symptoms, but they're not a cure. And incorrectly fitting and non-medical grade compression are dangerous. So to summarize, the critical role of the lymphatic system is fluid balance, immune defense. It's essential for fat absorption and metabolism, and it's impacted by aging, BMI, exercise, and inflammation. So here are my resources. And if you'd like to attend conferences in the future, love to invite you. We're meeting in Kenya in December with the VWIN Foundation, and the Egyptian Venus Forum is meeting next spring in Alexandria. And I'll invite you to both of those conferences. You're welcome to attend. And if you have any questions, please contact me on Instagram at Stress Reduction for Lymphedema. Thanks, and have a great day.